My name is Vanessa Rustad, and today I'm going to be discussing and going a little bit deeper into anemia. So here's just an overview of the presentation. We're going to discuss what anemia is, the different types of anemia, history of anemia, symptoms of anemia, diagnosis, treatment options, complications, and just kind of go over the history of, sickle cell, a little bit about what hemoglobin is, what iron is, and the huge significant piece of why our body needs iron and hemoglobin to function. So just a little bit about how blood cells are formed. Hematopoiesis is the process of making blood cells. Blood cells are made in the bone marrow, which is a spongy tissue located inside certain bones. The marrow contains blood-forming stem cells that make copies of themselves to create all three types of blood cells. When blood cells are fully mature and functional, they leave the bone marrow into the bloodstream. Healthy people have enough stem cells to make all the blood cells they need. However, this is when things get a little bit tricky, and we'll go into a little bit more detail about this in the slides ahead. So a little bit about anemia. The image you're going to see in front of you kind of is a good picture of what anemia looks like in a normal person with a normal amount of red blood cells, and somebody who is anemic that does not have enough red blood cells. So you can kind of see the white blood cells don't make much of a difference. The platelets, they're about the same, maybe a little less, but you can see the big significance of the amount of red blood cells. Why is that important? Red blood cells carry hemoglobin, which is an iron-rich protein that our body needs. It attaches to oxygen into the lungs and carries it to the tissues throughout the body. So anemia occurs when you do not have enough red blood cells, or when your red blood cells are not cooperating or functioning properly. A lot of times people feel very tired, fatigued. They may even have some very specific symptoms like melena, which is black stool. They may be vomiting blood, may have had a certain trauma which can indicate this. Other times it's very vague symptoms that ended up going to the doctor and they say, okay, let's get some blood work done. Typically the diagnosis is pretty straightforward for the most part in terms of anemia itself. They typically will draw a CBC, which is a complete blood count, may or may not have differential with it. They are going to be looking at a couple things. Your hemoglobin is number one. So your hemoglobin is the important number. If it is under 7, you qualify, or you need a blood transfusion. I shouldn't say qualify. That is when they start the blood transfusion process. But let's say your hemoglobin is around 8 or 9, which is still significantly low. They may do another test or 2 tests, which is testing your blood for ferritin. And they may also do some iron studies, which include like your iron binding capacity, just to see, is your body absorbing the iron? Is it making the iron it's supposed to? And typically people with anemia, they may have a hemoglobin that really teeters, which is hard because you get to a point where you want that blood just because it makes you feel better because you feel so terrible. And the way I have been explained and how I kind of explain it to my patients is that the hemoglobin is your checking account. Your ferritin is your savings account. That's your your give or your, what is a better word for it? Your storage. And your hemoglobin's kind of your daily spending. So what happens is when you deplete your storage, then we go into overflow, and then we can't keep up with our storage and our overflow, and that's what kind of leads to anemia. So I'm going to talk a little bit about, again, the significance of iron and hemoglobin, but a couple things about anemia in general. It actually comes from a Greek word meaning a lack of blood, or anemia. I believe that's how you say it. It is the most common blood disorder. And according to the National Heart, Lung, and Blood Institute, it affects more than 3 million Americans a day. Normal hemoglobin blood levels, 13 grams and 12 grams for men. Children values vary. And I'll go over that a little bit farther back as well. And it really breaks it down for you, even in terms of pregnancy, if you're menstruating, if you're postmenopausal, that kind of stuff as well. But iron really is a critical optimal functioning and survival of living structures. And I know this is a lot on this slide, but I think it's really important because if we don't have enough iron in our body, we become deficient, and the mitochondrial dysfunction happens. You're going to get abnormal transport of structural proteins. We're not going to get the oxygen to the all of our body parts that we need it. Our organs can become not up to par and impaired. We may have to reduce our workload, cognitive and behavioral impairments. You're not able to exercise. You have an increase of morbidity and mortality. Ultimately, I know myself, I've dealt with anemia, and it is awful. You feel like your head's going to explode. You are so tired. Your hands and feet are freezing, and you lay like a dead dog. That's sadly how I put it. But again, it affects everyone a little bit different, but it's usually a pretty quick, for most people, it's a pretty rapid decline. And then I just put another picture of the hemoglobin molecule. There's a red blood cell, and the hemoglobin molecule is those little tiny, they look like strands. And it's the iron that's binding to that oxygen that is a significant portion of anemia. So I kind of like to have little illustrations. I think it helps a little bit to understand it a little bit better. Just a little background, who discovered anemia. Thomas Edison was the physician who discovered it in 1849. And he was actually the first physician to kind of create a set of criteria for typical symptoms of anemia. Dr. Michael Biermer also assisted him. And actually, it was originally thought to be treated as an untreatable disease, and most people actually died from it because they didn't know. This was long before blood transfusions and the significant advance in medical technology. So it's kind of interesting that they didn't realize that it was treatable. So again, just some symptoms of anemia. I kind of talked about this. Again, with anemia, your body lacks oxygen. So you may experience one or more of the following symptoms: weakness, shortness of breath, dizziness, a fast irregular heartbeat, that pounding or whooshing in your ears, just almost like that headache that cannot go away. Headache, cold hands or feet, pale or yellow skin, you may even have some chest pain. I love this slide because it shows you an overall picture of the body, and how important the transportation of oxygen and how important that is in our body. In severe anemia, you can faint, chest pain, angina, heart attack, different symptoms, and it kind of goes through each body structure, organ. You know, your spleen may be enlarged, you may have heart palpitations, tachycardia, you might get an arrhythmia, shortness of breath, your skin, your eyes look yellow, you may get those black spots that are awful, where you feel like you're getting that tunnel vision before you faint or pass out. And obviously the intestinal changes of stool color. Typically, if it's a GI bleed, an upper GI bleed, your stool is going to come out black, which is called melena. If it's a lower GI, it's going to come out bright red, and typically, I would say most people that I've experienced, this isn't everybody, actually are hemorrhaging at that point. However, everyone's a little bit different, and your stool will be bright red and typically with lots of clots. So just a brief overview of the different types of anemia. I'm going to kind of hit on the big ones. Iron deficiency anemia, vitamin deficiency anemia, primarily B12 deficient, also called pernicious anemia, anemia in pregnancy, aplastic anemia, hemolytic anemia, and sickle cell anemia. So an overview again of iron deficiency anemia. This is the most common type of anemia. Your body does not have enough iron. The risk for anemia increases with age, especially in the elderly population. Some pregnant women, this is kind of an issue with. Interestingly enough, there are some additional symptoms specific to iron deficiency anemia. You can get sores in your mouth. I can't ever say this right. Koilonicus is an upward curvature of the nails, and pica, which is a real thing. You feel like you want to eat dirt or chew on ice. You know, even paper. Some people eat paper. Leg cramps, the pale skin, and the insomnia. Causes of this is blood loss, pregnancy and childbirth, gastric bypass patients, chronic diseases, GI bleeds or ulcers. Treatment is typically iron supplements first, iron-rich diet as well. You may need an iron infusion or transfusion and a blood transfusion. Which, again, the blood transfusion does not happen until that hemoglobin is under 7. And another thing to note, you know, sometimes it's hard if you're on the line, because if you're in the hospital and you're getting fluids, that's going to give you a false positive. The more hydrated you are, the less concentration of hemoglobin your blood will actually show. So just kind of an interesting thing. Next thing we're going to talk about is the vitamin deficiency anemia. This is when our body doesn't have enough red blood cells because it lacks B vitamins. These can be found in folate or vitamin B12. And our body really does need these to produce cells as they carry oxygen to parts of our body. The cause of this is it lacks intrinsic factor. This is a protein made in the stomach that is needed to absorb vitamin B12. This is called pernicious anemia. And some people have the inability to absorb B12 or B vitamins. This is very common in those who have had gastric bypass surgery, some autoimmune diseases, and even chronic gastritis. And this is because that part of the small intestine is gone, or may have an issue that is where the absorption takes place. Treatment options for those who have vitamin deficient anemia, B12 injections. Some people get them once a month. Some people do them weekly. Daily vitamin B12 tablets, folic acid tablets in a diet rich in folic acid and B12 vitamins. Pregnancy and anemia. Obviously, when you're pregnant, your body, the amount of blood in your body increases by 20 to 30%, which also increases the supply of iron and vitamins that the body needs to make that hemoglobin. So the best prevention is to eat foods in high iron content or take a daily iron supplement. A lot of times we test this quite frequently throughout your pregnancy to make sure that we're not coming into this, you're not getting too low in terms of your hemoglobin. Every once in a while you might get an iron infusion, which is done typically over 30 to 45 minutes, for 5 days, and then you do it every 3 months. Mild anemia is normal during pregnancy, and that's again due to the increase of blood volume. The severe risk for this puts your fetus at risk for anemia later in infancy. And significant anemia during your first 2 trimesters puts you at a greater risk for premature delivery or low birth rate of your newborn. Risk factors is having 2 pregnancies close together, pregnant with more than 1 child, significant vomiting and morning sickness, obviously not enough iron consumption in your daily nutrition, and if you had or have heavy pre-pregnancy menstrual flow. Aplastic anemia. This is a rare and serious condition when the bone marrow fails to make enough red and white blood cells and platelets. It can be acquired or it can be a hereditary trait. This can be moderate, severe, or very life-threatening. So again, the cause is the bone marrow fails. When the bone marrow doesn't make enough red and white cells, the platelets or the blood cells are damaged or defective. Acquired is it can happen at any age, most often in children, young adults, and older adults, and it's actually most common in Asian Americans. And each year, between 600 to 900 are diagnosed with aplastic anemia. And then again, the hereditary factor. And the only cure for severe aplastic anemia is a bone marrow transplant. And for those that are moderate to severe, blood transfusions as needed. Hemolytic anemia is a rare, is a blood disorder where the blood cells are destroyed faster than they can be created. This is called hemolytic because the work of hemolysis means the destruction of red blood cells. They kind of look like, you might see here hemolysis on like a differential, or if you're looking at a slide and they look like they're destroyed. So different types of hemolytic anemia is inherited, and this is when the gene is passed from one of the parents to their child. This is the most common condition in terms of sickle cell anemia or thalassemia. Acquired hemolytic anemia, this is developed later in life due to a condition. This is not something you're born with. Causes of this can be severe reaction to blood transfusions, which is why they're really sticklers about being under that 7 mark, because they don't want to have this happen. Hypersplenism, tumors, autoimmune disorders, mechanical heart valves, blood cancers, viral or bacterial infections, certain medications like penicillin, anti-malaria medications, sulfa, or Tylenol can actually cause this. Treatment options for hemolytic anemia is blood transfusions, corticosteroids, IV immunoglobulin, rituximab, surgery to remove the spleen, or immunosuppressive therapy. So this is pretty big too. And sickle cell anemia. This is the only cause of this is an inherited form of anemia. There is no cure, but there is treatment to relieve pain and help prevent problems associated with the disease. So some of the symptoms that people have with sickle cell anemia is painful episodes in their chest, abdomen, joints, and their bones, significant swelling in their hands and feet, frequent infections, delayed growth, and vision problems. Actually, people can become blind pretty quickly with sickle cell anemia. It was discovered by James Herrick in the 1900s. And again, what happens with sickle cell anemia, and I love this image because it looks like sickles or crescent-shaped red blood cells. And what happens is they get stuck in the blood vessels. and they basically act like a blood clot, is the easiest way I can think of it. So if they get stuck in the blood vessels, which can block or slow blood flow to moving parts of the body, which is what causes that pain. Treatment for anemia. So here's where I broke down kind of the daily iron intake by the World Health Organization. And this is typical for 97.5% of the population. Typically, you want if you're an adult, you want in the first trimester of pregnancy, you want 0.8. You want 6.3 in the second or third. If you're lactating female, you want 1.3 milligrams. And you can kind of see there too in children as well. Most of the time in infants, if they're formula fed, it's never typically an issue. That's always fortified in the formula. Breastfed, as long as mom's eating relatively well, I typically don't see much of an issue with that. Obviously, blood transfusion and iron infusions. And iron infusions are interesting. It looks almost like blood, but it's like sticky. They like to call it your go-go juice. Again, ferrous sulfate is the most common over-the-counter. And there are, I wanted to put in here also foods that are good for this. Bananas, legumes, nuts, dates, liver, obviously, whole grains. Fenugreek is really good. Spinach, so leafy green vegetables, red meats, beetroot, apple juice, pomegranate. Kind of some things that you can do to beef that up if it's kind of even on the low end. Or just some things to keep in mind for future. Complications associated with anemia, pallor, tachycardia, dyspnea, shortness of breath, easily fatigued, dizziness or fainting, tinnitus, which is ringing in the ears, headaches, dim vision, constipation, loss of appetite, heart failure, and edema, which is swelling. This can also be pulmonary edema, so you have the lungs fill up with fluid, your legs as well. So it can get pretty icky. Thank you guys so much for taking the time to watch this today. If you have any questions, just let me know, and this will also be on the YouTube side as well. Thank you and have a wonderful day.